मेरे साथ में डॉक्टर शक्ति गुप्ता हैं, प्रोफेसर डॉक्टर शक्ति गुप्ता, जिनकी किताबें पढ़ पढ़ करके मैंने हॉस्पिटल मैनेजमेंट सीखा। मेरे गुरु भी हैं और मैं उनको वंदन करता हूँ। हम हमेशा कहते हैं कि ना हम हंस कर सीखे, ना हम रो करके सीखे, जो भी सीखे गुरु का हो करके ही सीखे। तो आज आप मेरे गुरु को सुनेंगे, डॉक्टर शक्ति गुप्ता, फाउंडर डायरेक्टर एम्स जम्मू, और आजकल अपनी सेवाएं दे रहे हैं IIM जम्मू के अंदर। प्रोफेसर डॉक्टर शक्ति गुप्ता।
अभी इतना अच्छा माहौल बनाया एपी साहब ने, तो मुझे लगता नहीं कि मैं कहाँ से स्टार्ट करूँ अगली। तो मैं वैसे तो बड़ा कुछ बना के लेके आया था, बट लगता है कि मुझे ज़्यादा टाइम नहीं लेना चाहिए। तो बेसिकली आई बिलोंग टू ए वेरी स्मॉल विलेज इन JNK, which is about 3 kilometers from actual line of control. I had my primary education there. Then I went to Government Medical College Jammu for MBBS. Then Masters in Hospital Administration from AIMS Delhi. Then actually I have put in more than 45 years in the medical field in the health sector. I got the opportunity to work in All India Institute of Medical Sciences for 27 years, Delhi. And I got the opportunity by Honorable Prime Minister, who appointed me as a director of AIMS Jammu. And I completed my 5 years tenure in January. No, the Indian Institute of Management, actually, they did not allow me to sit at home. No, they have appointed me as a professor of healthcare management over there. No, I'll just actually, because Dr. Pradeep Bharadwaj told me to talk about the leadership. But I think it is not the forum to talk about, but I will share with you the salient features of AIMS Jammu and how the leadership can be done by, leadership is by doing or by execution actually. So, to start actually, because I am very fond of young people actually, and you know that actually in the future is the young mind, young leaders. So my message to the young people will be, I like those individuals who are daydreamers. Because if you take a dream during the day, you can translate your dream into action. And whatever dream you take during the night, by morning you forget what was the dream like. Second, which I want to share is, I like those students who are eccentric, lateral thinking, because they think differently and they think out of box. Only then they can bring innovation in their respective fields. If you start thinking on the same things, start working on the same, you will not bring any innovation. So a leader has to actually think differently out of the box to bring some sort of a new research or innovation or some new intervention actually. So dear friends, time has no holiday. Dreams have no expiry date. Life has no pause button. And let us move forward. While vision inspires and planning guides, it is execution that ultimately delivers the results. Leadership can translate intent into meaningful impact. When we think of institutions like AIMS or other institutes of national importance, we often associate them with excellence in healthcare, excellence in education, and excellence in research. So So these are the three important parameters, but they are incomplete unless we get involved into the community work. However, achieving these such excellence, especially in a developing region, the leadership requires more than ambition. It requires disciplined execution, timely decision making, and a relentless focus on outcome quality. Now, I just will like to touch for 4 or 5 minutes what we have done at AIMS Jammu in 5 years' time. Our vision at AIMS Jammu was a global village of healthcare. We don't want to limit our vision only to Jammu or India, but how we can bring experts from the global, from across the globe. So that should be the vision for that we have that. It means AIMS Jammu envisions a global village of patient-centric care, blending technology, skilled manpower, affordability, and Indian values to deliver world-class, accessible healthcare for every citizen of the country. Now, what are the unique initiatives we have started at AIMS Jammu? Our motto is patient first. What are we are doing? We are making beautiful buildings, purchasing equipment, latest technology, but we should keep in mind what is required for the patient, and patient is our. So every patient's comfort is a priority, and AIMS Jammu always dedicated to deliver compassionate, patient-centered care. Now, another unique feature of AIMS Jammu is that we have declared AIMS Jammu as a pain-free hospital. We say that whenever any patient comes to the hospital with pain, the pain should be outside the hospital. And once the patient is inside the hospital, he should not feel pain. Our Governor of Jammu and Kashmir, Shri Manoj Sinha ji, has declared AIMS Jammu as a pain-free hospital. So it is leading the way as region's first pain-free hospital, ensuring healing without suffering. Now, another important thing I want to share, we always keep on believing the public sector hospital or government hospitals because the projects are not completed in time. If the target is, say, 3 years, 5 years, it takes 10 years, 15 years to get completed actually. And AIMS Jammu is an example that we completed 43 buildings in AIMS Jammu in 3.5 years, and that too in one go. In one go we completed, and we made the patient care functional on 1st of August 2024. Now in 15 months, we started OPD services on 1st of August and established 45 departments. And 34 OPDs are running, including 20 specialty and 14 super specialty departments. And the surgeries are being done in all the specialty and super specialty hospitals, except the bypass surgery actually, where the surgeon was only one, so I did not want you to take a chance. No, if I keep on talking actually, but we need to get the feedback from the patient about the services. He is the best person. He is what we call as a customer. If he is satisfied, then you can find that the hospital is working or not. We always do a patient feedback survey. After the patient goes to the doctor, registration counter, system and processes, when he comes out, then we do the interview with the patient. What we have found that 81.86% of the patients, they have rated AIMS Jammu as highly satisfied, 17% as satisfied, and less than 1% as average, or they say satisfied, that is less than 1% actually. Now there we have very unique 193 ICU beds, of which 32 are already functioning. We have 20 operation theaters, 28 are already functioning. A very unique is the palliative care services at AIMS Jammu for the terminally ill patients. We have a very unique patient information and management center, and mandate is to provide round-the-clock poisoning and management services over there. Then there is a very unique feature in AIMS Jammu, that is a patient assistance services. What I want to convey is there is a dedicated staff which has been appointed for the patient assistance services. Whenever a patient comes who requires wheelchair or trolley, it is our responsibility. It is not the duty of the patient's attendant to take their patient in the wheelchair or the trolley. So we have put patient care managers, really qualified, patient care coordinators, Rogi Sahayak Mitras, and Parikrama Seva, that is a shuttle services. No vehicle are allowed inside, but our own electric vehicles, they keep on moving, taking the patient inside the campus, because it is a huge campus, about 227 acres. In addition to that, we have a patient-centric infrastructure, and there is a provision for night shelter, that is a Vishram Sadan for the patient's attendant, which is an excellent, air conditioned, very nominal charges. Food services are also available for the patient's attendant. Now, MBBS, we have 125 MBBS students every year. 6 batches are already there. 60 BSc nursing students. And then we have postgraduate under 25. We have started MCH and in pediatric surgery, in DM in endocrinology in a short span of 15 months. Then we have started a very unique program over there, that is a MBA Hospital Administration and Healthcare Management. That is, we have signed an MOU, AIMS, IIT and IIM Jammu, and we have started 2 years this MBA Hospital Administration and Healthcare Management program, which was launched on 23rd October by Honorable Home Minister Shri Dharmendra Pradhan, Education Minister Governor Sahab, and then the Dr. Jitendra Singh. It is a first of its kind program in the country, which is enlisted in CATS, 100 seats, and teaching by eminent faculty. The structure is 1 year teaching by the IIM, 9 months by AIMS, and 3 months by IIT, and the degree is signed by all the 3 directors. So that is a very unique feature program we have started. In addition to that, we have also started joint PhD program. That is the faculty of AIMS and IIT. They have a joint PhD students. Then MBBS and PhD program we have launched, because every MBBS students do not want to go for the PG. So they have an opportunity to get registered for the PhD program also. Then actually, if we talk of geographical distribution, we have a faculty from 20 states. We have residents from 21 states. We have nursing from 21 states, and other staff of 15 states. It is a true representation of India in Jammu itself, actually. So these are some of the things which I wanted to start, but there is a very unique digitalization of AIMS. That is a seamless integration of healthcare ecosystem with CDAC. In addition to that, we have an app-based appointment system. We have an indoor patient navigation system, which is not there anywhere in the country, where the patient app is available on Google Play Store. You just scan the QR code, download app, enter where you want to go. It will exactly guide you that you take 30 steps, turn right, take left, go to 4th floor, this is your destination. And this is very unique, actually we have started over there. Then in addition to that, we have a digital library. Then actually there are a lot of one facility which I am very proud that we established a center for advanced genomics and precision medicine, which is not there in the country. And it has become a referral center, not in the country, but we are getting samples from across the neighboring countries. The cost of this test is being sent to US for testing, for genomics and this next generation sequencing, which costs 5 to 7 lakh rupees. And same test is available in AIMS Jammu from 15,000 to 1 lakh rupees. And the results are made available immediately. Very unique feature we have started. We have established a artificial limb and caliper making center, that is a Jaipur Foot, and we are providing free. to the patients. Total expenditure is being borne by the Jaipur Food actually. Then actually we are very committed to the community outreach program. Like I said that if we don't want to confine to the hospital, we want to reach to the community. Now we have submitted a proposal to government of Jammu and Kashmir to adopt one community center where we put our doctors, nurses, technicians on rotation basis and 3 months basis, so that these services are available to those areas which can serve a population of 2 lakh. No, we are ready for any disaster situation. This is an area we can work together. We are already discussing signing an MOU with them also. And AIMS has played a very important role during the Operation Sindhur. Very actively we have participated into that. And then actually there is a very unique, that is a Bhishma Cubes, that is a Bharat Health Initiative for Sahyog, Haita and Maitri. This is a mobile hospital which can be actually installed within 4 hours time actually. And then this has a capacity of handling 20 emergency patients a day and 10 to 15 basic surgeries a day. In addition to that, actually we are having a collaborations with the national and international level. We don't want to work in isolation and we are working with them actually. Thank you so much for giving this opportunity.
Thank you, Dr. Saab. Thank you very much.